My name is Pamela, and I'm one day out from a facelift, fat transfer, and a hand transfer from Dr. Lamb. I am thrilled because I got some previous work corrected, my eyebrows, and I'm very happy about that. And I'm really pain-free. This has been very exciting, and I'm sure very rewarding. I'm looking forward to the 2-week period. And this is the results so far.
As you heard from Pamela, she is one day out after having face and neck lift, full face fat transfer and fat transfers to the hands. And I just want to show you that the patient does very well after a day of a procedure. It's not bad at all. She's doing very well. She had a brow lift, as you heard from her. It was a little bit more uncomfortable. That was done elsewhere. And I just want to show you that this is not a big deal. Turn gently over to your, yeah, that's it. There we go. So you can see the incision line there, and it's slightly pulled look if you look at that, and that's a normal look. There's a slightly uneven quality to the skin, and that's normal as well. That will begin to fade in the next 2 weeks. Turn over to your other side for me, and there's a little bruise on the left lower eyelid, and also you can see that there's a little redness to the ear, and there's this little bit of a tight look to the jawline and neck, and that's just absolutely normal. That takes about 1 to 2 weeks to completely settle. We are now demonstrating how to wear a little chin up. This is about the only thing other than cleaning the incision lines that Pamela has to do. So I'm going to show you basically just opening this little wrap up. There's a soft silky side here with a wider edge on this side. That's going to go in the front. And so I don't want this tight. I'm just going to lay it down and rest it right across the chin like that. And these is going to go up over the head and then just like this. And it's going to be a very comfortable way, just as a sort of to keep all the tissues up where they want to be and a little bit tighter than just having nothing there. And it'll help support and reduce the swelling over the next week. But not tight. That doesn't feel tight to you, does it, Pamela?
No, it does not.
Good. So that doesn't feel tight to her. And she's just going to wear 24/7 if she can for the next week. Unless she goes to the store, she could wear a scarf instead or do something else. But if she could wear that for the next week, I think it would help a lot.
Great. I am now 7 days out from a full facelift and a full fat transfer on my face and hands. The week has gone very well. I've had very little discomfort, and I'm just enjoying watching the changes and seeing how my face is coming around to look softer and making me more happy.
As you heard from Pamela, we're 7 days out now, and you can see she looks pretty good. Most of the swelling has gone down into her chin and jawline, and she's got just a little bit more fullness down there, but the whole face is still quite full, and this is just mostly swelling. She's got a little bruise on the left lower eyelid today. We're going to go ahead and laser that to bring that down under control, and probably, for the most part, in a few days, make it almost not very visible at all. Let's go and turn to your right. And let's take a look here, and you can see there's just a little fullness along the jawline. That's all normal. And let's turn the other way. And same thing over this way. You can see there's just a little fullness along there, and that's all normal, and there's a little bruising down there, and that's all going to settle. We're going to do a little lasering, and it looks really, really good, very, very natural. You can see most of all that pulled look is almost about 95% resolved as well, and everything looks good. We'll follow her in the next few days to a week.
I'm 10 days out from my fat grafting and facelift. I just had my sutures taken from under my chin. All the swelling seems to be going down very nicely, and I'm looking forward to bringing Dr. Lamb some eggs from my showgirl chickens, my pets.
As you heard from Pamela, the reason we're here today is to remove the sutures under the chin. I usually like to do that about 10 days out. You can see that the lower face is still a little congested, but is much better from about 3 days ago. And the laser, we lasered the bruising down. There's just a hint of color there still. It's actually a red that even Pamela told me I was pretty easily coverable last night with makeup. So before, that dark purple stain is pretty much gone now. Go and turn to your, turn this way over here. Yeah, very good. You can see there's still a little bit of swelling along the jawline and the neck, but it's come up quite nicely. Let's turn the other side. And you can see the same thing over here. There's still some swelling along the jawline, but it's looking quite good right now. We'll see it in a few days.
I'm now 2 weeks out from my surgery, and the swelling seems to be going down very nicely, and I'll be honest with you, I can't wait to get up every morning and see what slight changes have happened. So far, everything's just been great.
As you heard from Pamela, we're now 2 weeks out from having the facelift fat grafting and the hand fat grafting. And as you can see, almost all the swelling, deforming-wise, has been resolved. The pulled look has dissipated. Pamela, go and turn this way over here. And you can see most of the swelling is pretty much gone. Turn to the other side for me. You can see it's a really, really nice result and just barely even perceptible incision lines at 2 weeks. We're going to go ahead and zoom in and see what we can see here. This close-up photograph here, you can see that the incision line is barely perceptible, just a little bit red, and that's going to start fading down. There's still a little bit of swelling there, but the ear lobule looks normal. It's still anymore. It looks very natural. Let's turn to the other side. As you can see here, this incision is just barely perceptible. With my facelifts, I never remove hair. There's not visible incision lines that are outside. But you can see this incision line at 2 weeks is not even perceptible. The skin looks smooth. There isn't a pulled look anymore, and it just looks really, really natural.
I'm 3 months out now, and I've lost a lot of the puffiness in my face. I'm very pleased with what has happened so far, and I'm looking forward for a continued nicer look.
As you heard from Pamela, we are now 3 months out. Most of all the swelling is down, and it looks gorgeous. You know, as we talk about other video stories, it really takes a full year for even more beautiful shape to show up. Let's go and take a look at those facelift incisions too. I want you to turn over to this way, over this side over here. You can see you can't even see the incision. It's perfect. It's beautiful. It's soft. The neck is up. There's still a little bit of swelling at 3 months, and that neck, the way that I do it, continues to tighten over a period of a year. It should even be better at 6 months and 9 months. Let's turn to the other side, please. Try to find that incision. Cannot see it. It's beautiful. That's 3 months out. She's doing great. I just want to follow you at this point and just to show a longer term follow-up from what we had before.